Hello, so my topic for the week is stem cell transplant, and I wanted to talk about what goes on before the actual transplant takes place. So a patient with, let's say, leukemia is going to be scheduled for a stem cell transplant. The stem cells are what make all the blood cells in your body, red blood cells, white blood cells. Everything stems off of them. That's how I think of it. So either you can get an autologous transplant, which is from yourself. They harvest the stem cells from you, and then they give you chemo and radiation, either or both, and then they give them back to you after the treatments. Or it can be from a matching donor, which is called allogenic. So what's going to happen before your stem cell transplant is you're going to get chemo and or radiation. They can do radiation on a certain part of your body, or they can radiate your whole body. So what's going to happen is that the chemo and radiation are going to prep your body for the transplant, which means it's going to kill off the cancerous cells, as well as it can kill off, and it will kill off, some of your good cells, non-cancerous cells. So when you hear of neutropenic precautions or a neutropenic diet, which I'll talk about, it's because you're at increased risk of infection from not having enough white blood cells circulating because of the treatments you went through. Lay down. And it's going to put you at to fight off an infection. So we're going to try to, I'm going to give you a little education on what to avoid to keep yourself healthy, and when to call your provider. So, the neutropenic diet. So you hear of no fresh fruits or veggies, which you would say you want to keep healthy and you want to do that, but the risk of infection comes from the skin of the fruits and vegetables. So if you can wash things off, or if they have, like for example, like grapes, you can wash these off, but you're going to eat the skin when you eat the grape, so it's not a good item to have in your list. Or like the same thing with like a cantaloupe. So cantaloupe, you can wash the outside, which is great, but then when you cut into it, the knife is going to bring the bacteria into the fruit, so that's not a good one. But bananas that I have here, those are good because they have it comes in a package. You can open it up and eat it, and you're not going to get any of the bacteria in the fruit. So that would be okay to have. Let's see. Unpasteurized foods like milks, honey, orange juice, cheese that's not pasteurized. Most things that you can get in the store are fine. You just have to read your labels. Nothing out of date or close to out of date, just because your body, a normal person's immune system can fight off things like that, but once you've had these treatments before your stem cell transplant, you can't. And you don't want to risk it. Another thing too, like today, like say I bought this chicken pot pie from the grocery store. You think that's nice and easy to do, you just grab it, but prepared foods are not good because you didn't prepare them for yourself. You don't know if it was thoroughly cooked up to your standards, and you can't eat anything that's been sitting out for more than 2 hours, just because, again, risk for growing any kind of bacteria or something that can be harmful to you. Avoid acidic foods. You don't want to have any breakdown in your mouth or any GI upset that could imbalance or open you up to infection. Don't share utensils. Make sure they're nice and clean. If you have a dishwasher, make sure everything's washed on hot. Or if you can't, then maybe even get plastic disposable things. No raw meats. Thoroughly cook everything to avoid any kind of infection. Like, again, I'll just keep saying that. And for hygiene purposes, You don't want to, if you do feel like you're not feeling well, or you sense some, sore throat, you're just not feeling good, and you think you have a fever, you check it, it's 100.1. So you're like, oh, I'll just take some Tylenol. You don't want to do that until you talk to your provider, just because it could be, you don't want to take Tylenol and mask an infection. You want to always be in close contact with nurses, doctors, to make sure you're okay. You don't want to do anything to introduce bacteria into your body. Not necessarily, it's not all elderly people that are going to have this procedure. It's, it could be young people with leukemia. So no tattoos, no body piercings. Don't go and get manis and petties just because you can be introducing bacteria into your body. I didn't know that. I didn't even think of that. No suppositories or rectal temperatures or anything rectally, just because increased risk of breaking the skin, infection, bleeding. And this is also another thing that I didn't realize was you could inform your patients. Try to avoid using tampons during neutropenic periods, just because you're introducing, if you think about it, you could introduce bacteria into your body. Let's see, water. It's good to have bottled water if you can, and anything canned or is okay, but like I would suggest using like something with a twist top. Like a can, you'd have to thoroughly clean the top of it. I don't know, some people will just, or you could open it and pour it into a glass if you can't find those. And I just wanted to talk about too, fresh, you can have frozen vegetables or cook them. Like I made a pizza today. I have, I grow my own like little herbs in an herb garden, but I wouldn't suggest that someone on neutropenic precautions eat fresh herbs. I would cook them, so I put them on a pizza. Or you could suggest they use like an instant pot to pressure cook their chickens and meats, just to make sure they're thoroughly cooked through, and to make sure that they don't get an infection. So once all this is good, then they can be cleared to go on for their transplant, which will take place either they can have them transplanted into their iliac crest, or sometimes they harvest too from the sternum. But that is it. Thanks.